In this video, I'm going to be showing you how to do a controlled articular rotation for the wrist joint. For demonstration purposes, I'm simply going to do this unilaterally, so just one arm at a time. And I'm just going to keep my forearm facing the ceiling, palms facing the ceiling as well, and I'm going to keep my fingers together, okay? So I'm going to pretend like a marker is at the tip of my middle finger, and I'm going to start by flexing the wrist, bringing that marker towards my face. I'm going to bring that marker in towards the midline, keeping my fingers together without folding through my fingers. And then when I bring it all the way in, I'm going to come down towards the ground. As I point my fingers down towards the floor, I'm coming down and out. So I'm just drawing a circle with that marker at the tip of my middle finger. Notice my forearm isn't moving, then I'm going to come down and out. And as I come down and out, I'm going to come out and up, bringing that marker back up towards my face, but keeping my forearm completely still, my fingers completely flat and straight, my palm nice and stable. So a little bit faster, it looks like this. Okay? Okay, so that's a controlled articular rotation for the wrist joint. Obviously, if you wanted to reverse it, you just go the other direction. Now, I want to talk about a couple of things regarding the anatomy of the wrist and why it looks, or why the cars look a certain way. Your ulna, which is the bone on the inside of your forearm, and your radius being the bone on the outside, your ulna is slightly shorter than your radius. And this is called an ulnar tilt. So that angle, or that difference between the length of the ulna and the radius is called an ulnar tilt. So when you go into what's called ulnar deviation, you'll have way more ulnar deviation than you will radial deviation. So when you bring the wrist in towards the midline, you'll have way more range of motion there, or movement excursion, than you will when you go out. So in my case, I happen to have a little bit longer radius compared to my ulna. So this is me pushing as far out as possible. So the ability for me to go into radial deviation is definitely a little bit more limited compared to my ulnar deviation. So if you think about the wrist cars, if you visualize that marker, that circle isn't going to be directly in front here. It's almost going to be shifted out to the side a little bit. And it's going to look like you're moving or creating a circle here. So don't try and force radial deviation when you know you can't get it. Just know that you're at that limit and try not to compensate, because if you try and push it past the bony limitation, you're most likely either going to press the elbow into the body and almost like do it like an external rotation, or you're going to start to move through the fingers. Just understand that, right? That tilt is what makes you have more ulnar deviation. Doesn't mean that you can't get some of that back, especially if it's soft tissue limitation, but at some point you will find that you run into a bony limitation to radial deviation. That's okay, totally fine. Now, similar to how you have more ulnar deviation than you do radial, when it comes to flexion and extension, there's something called a Palmar tilt. So now the radius has a slight decline on the palmar side versus the dorsal side. And so you'll actually have way more wrist flexion than you will extension. And so that being said, same thing, when you go into this wrist car, you'll be able to go into way more flexion than you will into extension, which is fine too. Now the difference, in my opinion, isn't as large, and some people it might be, depending on what ranges of motion you might be missing or lacking. But something else to consider too as well is that when you go into flexion and extension, because of that ulnar tilt, you're actually going to have almost like a coupling of flexion and ulnar deviation. So you'll have way more range of motion in flexion and ulnar deviation, almost like at this diagonal, and then extension and radial deviation. So that's kind of how that wrist car comes together, and some of the things you want to keep in mind. Now let's talk about the forearm. So we're trying to isolate the wrist, right? And we're trying to really create that controlled articular rotation through this joint here. Now, for the forearm, we don't want to have pronation, supination occur, right? Because we don't want this to happen, right? Because we're just trying to isolate motion here. So to dissociate the wrist from the forearm, you want to make sure you pretend like I actually have my TV remote here, and I'm going to use as an example. Pretend this is a cup of water. I think it's a better visual. But if I keep my imaginary cup of water or my TV remote here on my forearm and I go through this wrist car, I should be able to isolate and really push through my wrist and create as much excursion or movement through my wrist as possible without that forearm rotating or spilling the water or the imaginary water. So that's the compensation, right? Kind of going through the forearm for lack of control at the wrist. Very, very common. So you want to make sure you dissociate that. The only other thing I want to say really about the fingers is try and keep them straight and try not to flex through your fingers here or through your knuckles, just to really lock in and create a nice flat lever for the wrist joint to move, for you to visualize, because this is definitely something that you're going to try and do. If you're missing flexion, you're probably going to try and flex through the fingers. If you're missing extension, you're going to try and like spread and come back. So just keep this straight and just focus all your intention around the stuff happening around this area. So that's how you do controlled articular rotations for the wrist.